as I click away. Click, click, click. Point of payment for the service provider. So we went on the right side of this scale, if you will. So how you pay, how the company pays. Now, how does a doctor get paid, or what we call the service providers? This could be a doctor, this could be a lab tech, this could be the x-ray tech. How do they get paid? Well, they have to work through the insurance company. They don't get paid by the company directly, and they only get a small portion of the lion's shares from you when you actually do a co-insurance or co-pay. So they let's start by thinking of them as independent entrepreneurs. They have provided a service of which they want to get paid, just like a plumber coming to your house fixing the pipes. They want their money. So the law of supply and demand, here it is. The insurance carriers, they provide the supply of lives. Remember, we talked about the pool of lives. And the providers, or the doctors, provide the demand for service. So here we go. Providers and carriers negotiate rates for these specific service types. For example, an office visit. A doctor's going to say, look, insurance company, I charge you $150 per office visit. That's it. This is part of the negotiation. Insurance companies come back and say, whoa, 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 whoa. I'm giving you access to a pool of over 150,000 lives. Look at all these companies I have. Look at this pool of people I have that would come to your office because they will be part of our network. We're only going to give you $75 per office visit. So usually the doctors or the service providers say, okay, I'll take it. This can go on for x-rays, every type of service you can talk about or speak about in the benefit world, lab work, etc., etc. So again, kind of messy on the left-hand side. Let's clean that up. Enter what we call the, once when they've all been negotiated, this doctor and the insurance carrier, let's enter a claims processor. This is a third party because this doctor or service provider works with multiple insurance carriers, works with multiple plans, has multiple schedules set up. So what they charge one person on one plan, they could charge someone else for the same service on a different plan. Why? Because let's remember, the independent entrepreneurs, they probably want to pick up every loose dollar they can, because as you saw earlier, their insurance carriers are limiting what they can make. So this claims processor handles all the billing for them. So they assist with the administration of all the negotiated rates with the carriers. So the doctor's saying, look, here's a claim. Mr. Claim Processor, figure out how much it needs to be billed. Go to their insurance company so everything works out. So they work with the insurance carriers. Figure that all out. So, and then finally, the insurance carrier, once it is all figured out, pays the doctor, or I'm sorry, the service provider. There's where the money, that's how a service provider gets paid. So I guess this all comes down to, like I said, I try to simplify this as much as I could, but the big question is, so why is healthcare so expensive? Remember the pool we talked about? Well, of course, that pool comes from insurance carriers and or from companies. Well, that pool is, or at least the health experience of that pool and the claims experience is increasing year over year. Just like the Ponzi schemes for financial communities, there's kind of a quasi-Ponzi scheme for the healthcare and health industry, where you need healthy people to help offset the claims of the unhealthy. So you need healthy people to pay in and not use the service, where the unhealthy people are still paying in but use the service a little bit more. Because obviously what you pay, and if you have a high claim, it's not going to cover the whole cost. You're relying on the whole pool of people and that pool of money to cover the cost of the insurance or the high claimants. But that is, we got the baby boomer blip going on. That pool is just, it's not going away. I've seen double-digit increases year over year for the past 8 to 10 years, and it doesn't look like it's going to get any better, to tell you the truth. So continue to have our paychecks and premiums being eaten away by our health care, and hopefully we will all have health care in the future, but we'll see how that pans out here in the next couple months. Let's back that out. So as I said, the claims experience of the lives in the pool are increasing over year. Second thing is the cost of doing business for service providers is increasing. They have to get insurance because they're sued by lawyers, and that's the American right. I don't want to take that away from anybody, but that is a cost of doing business. They have to get insurance for themselves, which keeps increasing their building costs, all that stuff. So yeah, they're going to pass that cost along somewhere. Medical advancements, R&D. We have a lot of technology here in America, that more so in other countries, that we spend a lot of money on, that costs money. and it has improved, or the theory is it has improved the well-being of the health industry and the service that can be provided service that could be provided to individuals. So that is at least my theory on why the healthcare is so expensive. And this is my 2 cents. Hopefully you've learned quite a bit. It is in a nutshell, but it is not you just paying $20 per office visit. That's not going to cover it. You can see there's a lot more going on. If there's any questions, I guess you could subscribe or something, and I can kind of get back to you or just make a comment. So farewell. Have a good night, and good luck, our leaders there in Washington, and hammering this quagmire out. Thank you.